Welcome.
Thank you so much for having me. I'm super excited to be here.
I'm super excited to have you here. I've had quite a few plastic surgeons on my podcast,
Okay.
and I don't know that I've ever had a female plastic surgeon, which is a little bit shameful to say. Actually, no, I think I had Dr. Devgan on years ago, years and years ago, but I'm so excited to talk to you. So, welcome.
Likewise, thank you.
Yeah.
Thank you.
So, maybe to start, I would love to hear from you what your beauty philosophy is.
So, my beauty philosophy has always been that natural is on trend, meaning I feel like the goal of plastic surgery, whether or not it's surgical or non surgical, the goal should be that there are no telltale signs of any work being done. And so that's my goal personally. And I translate that into my practice as well.
And you said that's always been your philosophy from the beginning. When you got into surgery, was that what you intended to do? Like, did you want to kind of bring this aesthetic to the industry? Because I feel like the pendulum swings a lot, and especially in Los Angeles, like natural has not always been the goal, I don't think. Um, so maybe we can like rewind a little bit and you can talk about like why you got into surgery and what your intention was and if it was that.
Yeah. So if we rewind even further back, my original plan was to be a cardiac surgeon. So doing like heart transplants, and that's a lot of what I did in medical school. And I realized though during that whole process that I loved the reconstruction and the reconstructive aspect of plastic surgery. So initially, that's what I was going to do. But then I really fell in love with the face and facial aesthetics, and it's something I've always been interested even since I was young. And a lot of that was from my mom when I was even 7 or 8. She was always very interested in symmetry of the face, and someone gifted me like a makeup book when I was young, and it really demonstrated how do you best enhance features of the face, and so that's something I've always been interested in. And I personally, like I was saying, really do have a natural aesthetic. And when I came out here, it wasn't my goal to, disseminate that, but it really was, I think, something that set me apart from a lot of plastic surgeons and a lot of different aesthetic results that we see out here, which tend to be overdone and obvious. And so naturally, I think patients who wanted natural results gravitated towards me. And now I think we're just seeing in general a lot more natural results in general.
How was it going into the field? Because how long ago was that you went into surgery, plastic surgery?
So, plastic surgery, I entered into it in about 2011, and then I moved out here around 8 years ago. And so, it's been a really great journey. I actually moved out here initially because I loved surfing, so it wasn't really because of anything plastic surgery related initially.
Is it kind of a stereotype or an overgeneralization to say that it's a male-dominated field, or is it in fact still very male-dominated?
Yeah, it's definitely still surgery in general, but plastic surgery in general is still very male dominated. Less than 20% of plastic surgeons are female. And I think of that, single digits that do face. And so, it makes sense probably why you haven't had a lot of female plastic surgeons.
Yeah, I'm curious if you feel like that's a hurdle that you have to overcome when it comes to patients as well. I mean, is there any kind of like internalized, I don't know if it's misogyny or what, where people are more inclined to go to a male surgeon than to a female? Like, did you feel like you had to work harder to get to where you've gotten because of that?
Yeah, that's a good question. I would say during training, you definitely feel like you're, in the minority. There's two women in my whole plastic surgery class. And so I think it's a plus and a minus. I think that definitely there's a lot of advantages to being a female. We have breasts, we use makeup, and I think it's allowed me to really understand my patients better. And then in practice, I would say that I think a lot of women like having a female doctor. And so it's been, I think, great for me.
I have not personally gone to a female plastic surgeon, but I've had a few procedures with male doctors, and I could definitely see the benefit of going to a woman. I think that there's probably a level of comfort, and to your point, just a different understanding maybe of goals and of aesthetics, like, and personal taste in aesthetics. And I remember Dr. Tally, who I've gone to a few times and who's been on the show a few times, said to me once that plastic surgeons are like designers and they're all different. Everyone's got a different style. And you can go to a doctor and they're going to interpret whatever it is that you want to do in their style. And that's going to vary across, different people, different genders, I'm sure. Um, and I think it is so interesting that you had that book and that you were so into makeup and you understand a female face probably in a different way than a man does.
Definitely. I think that's a good point that you brought up earlier. And I think I always discuss with my patients during consultations that there's really that artistic aspect to plastic surgery that we don't really see in other medical professions. So, for instance, my brother is an orthopedic surgeon. If the bone is broken, he fuses it, he plates it, and takes an X-ray and it's done. For plastic surgery, I could do one side of the facelift, somebody else could do the other side of the facelift. We could do the exact same technique, and it will look different. And that's really the artistic component of what vectors are you pulling in? How much are you pulling? How tight are you tying it? And so I think all of that goes into the individuality of the plastic surgeon.
Yeah, I think that's such an important element, the artistry of it. And I remember I had somebody else in my podcast, I can't remember who, but they were saying like not every surgeon is an artist, unfortunately. You have to have that eye and that skill. And it's not just something that's innate just because somebody goes into plastic surgery. And I think that's a big hurdle when it comes to patients selecting a surgeon. And, I get flooded with DMs all the time asking for doctor recommendations, which I'll never do, and asking how to pick a good surgeon. And I'm like, it's hard. And especially now, like in this era of, Instagram, social media fame, anybody can get a following, but that doesn't necessarily reflect the work.
Right. I think that's a great point. And I think it's really important for patients when they're trying to find the right plastic surgeon is to really look at before and afters, because I think before and afters really demonstrate somebody's artistry. And if you're not liking what you're seeing on the before and after, chances are you won't like your results. I also think it's important to look at the plastic surgeon. If they look weird, I think chances are you'll look weird. So, that's a great point. And I think also referrals, if you have friends that have gone there or people I think that can really help you decide as well.
Yeah, among my friends, I mean, we'll talk about this stuff all day and I'll recommend if I've gone to somebody who I really like. Um, but I just feel like I don't want to be responsible if, God forbid, somebody is not happy with their outcome and I've recommended them to go to this practitioner, and it's just like I can't deal with that guilt. But at the end of the day, like hopefully people do their due diligence. And even if somebody recommends somebody, they go ahead and they do look at the before and afters and do look at the overall big picture and see if it's somebody that they feel comfortable going to.
Yeah, exactly. And I think the point you made about the following on social media and Instagram, it's really important not to equate a large following with, the result, because I think oftentimes it's the opposite. People that tend to have a big following who spend a lot of time on social media aren't spending a lot of time on their patients and their practice. So I think it's really important to look at that as well.
Okay, so I want to get to the aesthetic of it all. We were kind of talking in the beginning about how, especially in Los Angeles, like things have not always been this natural aesthetic. And it varies city to city and across different countries and all that. I always say when I go to New York, I feel different than how I feel here because the aesthetic there is different. I don't know. And then it's different if you go to Miami and it's different if you're in Dallas, it's like it kind of trends differently wherever you are. What do you think we get wrong? And what do you think we get right about aesthetics here?
Yeah, that's a great question. So I definitely understand what you mean. I think different cities have different styles and different trends and different goals of patients. And one thing I find is that, natural is always on trend. One thing that I think we're really going to see a shift in is not looking at age. So a lot of people will say, I'm this age. Does this mean I'm ready for X procedure? Or I'm too young for this procedure, or I'm too old for that procedure. And so I think that, it's really what we're seeing on physical exam that determines whether or not somebody's a candidate for a procedure. I think the other thing that a lot of people, practitioners, injectors misunderstand is the use of filler and how filler isn't really used to lift. And so if you view filler as lifting, then you're always going to tend to overfill. And when you overfill, oftentimes that leads to a wider face. It leads to the eyes looking smaller. It can often widen the base of the jaw, which can look more masculine. And so I think that's something that we're really going to see a shift away from. And I think another misconception is also that surgery is more invasive and that it can lead to unnatural results. I often find the opposite. So I find that a lot of non-surgical procedures, such as filler and threading, can lead to patients looking much more unnatural than doing a surgical option. And so I really think that is going to start. I think patients are going to become more educated on that, and we're going to see a lot more of surgical procedures rather than overdone injectables.
Yeah, I feel like there is a little bit of this cycle that people get into with the less invasive things because they think okay, this is less invasive. Maybe it's less expensive than surgery if you kind of look at it like each time. I don't know if that's making sense. Whereas, if you look at something like threads, for example, I don't know, it's maybe $3,500, $5,000, somewhere around there each time you do it. Minimal result, in my opinion. I did it once. It was not
I
the
completely
vibe.
agree. I hate threads.
Not the vibe. It was
Yeah.
traumatic. I was like, oh my God. And, if people are doing that repeatedly, like just, save for surgery. Same thing with, like you're saying, with filler. Um, Other procedures, I'm sure a lot of the lasers, people are going down those roads as well with like RF and maybe doing that too much and then damaging the tissue and all. Are these things that you're seeing?
Yeah, definitely. I see that a lot with ultrasound based. So, specifically, Althera, what we've seen is kind of long term damage to the tissue and to the subdermal plexus. And so, when I'm doing a neck lift or a facelift on someone who's had Althera, I always counsel them that they have a higher risk of seroma formation, as well as some possible um, decreased blood flow to the skin compared to patients that don't have a history of Althera use.
So what does that do to the skin if you have decreased blood flow?
So when you make incisions around the ear for a facelift, you're cutting off blood supply from other areas above the incision. So you always want to make sure somebody has enough blood flow. Sometimes that can lead to decreased wound healing if there isn't enough oxygenation to the tissues. And in those cases, I'll send patients to hyperbarics.
Got it. Okay, so somebody walks into your practice, say they're in their, I don't know, early to mid 30s, late 30s, somewhere around there. I feel like this is the age where people start to notice things changing. I, for myself, feel like around 36, I was like, oh, or 36 or 37. I was still doing Botox at that time. Um, but that was when I really kind of think that I accepted like the aging was happening and things were changing. Um, so since you don't treat a number, if somebody is seeing things like maybe early jowling, maybe some drooping of the brow, what are you going to do first?
The first thing I always ask when someone comes in for a consultation is, what's your goal? And I think based upon that answer, then I really look at the face as a whole and look at the balance of the different features and what's contributing to whatever we're seeing. Oftentimes and surprisingly, a lot of the jaw-based aging that we're seeing, especially at a young age, like 30s, can oftentimes be to a skeletal deficiency or recession of the chin. And so something easy there would be to place either a small chin implant. Much prefer that over filler, but balancing the chin can really make a difference in the jawline. With the brow, depending on what we're seeing, either something like it could either be volume based. So when you lose volume in the temples, the brows tend to drop. It could be due to someone just genetically always having lower brows. It could be as simple as using a few units of Botox around the brows to lift it, or you might need something surgical. So it kind of really depends on what I'm seeing.
What are the trends that you're seeing in surgery right now? Like, what are the big things that people are wanting to get done? I know a couple years ago it was probably like the Bella Hadid eyes, brow lift that and Kendall. I mean, all of these girls kind of set this trend, allegedly, whether they had surgery or not, we're not saying. But that was kind of the aesthetic that everybody was trying to do. And people were trying to achieve that with things like threads too. And a lot of places were marketing threads and even brow lifts, surgical, as like the Bella Hadid eyes, cat eye, fox eye surgery, things like that. Are you still seeing that? Are you seeing like bluffs? I feel like everybody is getting a bluff now. What are the big ones?
So I would say that there's definitely less people coming in looking for an exaggerated look. That being said, the patients that gravitate towards me don't typically ask for that, but I'm definitely seeing that a lot less on social media in general. I think what most people come in for is really more how can I just enhance my features as opposed to I want to look like this celebrity. And so we really focus on that during the consultation. And I would say what we're seeing a lot more of is earlier surgical procedures, but minor. And so I think blepharoplasty, upper and lower, are something that I'm seeing patients coming in their mid late 20s, and then definitely things to improve the cheek and the jawline. So whether or not that's some sort of surgical procedure to lift. And so I created the Bijou lift, which is for my 20 and 30-year-olds and sometimes, late 30, early 40s, where there's not a ton of skin, but you are seeing descent of the soft tissue. It's not enough to do non-invasives. My patients in that age range feel like they're not really getting enough of a lift. And so I'll do small incisions, some endoscopic type incisions to lift and access the face and the jawline.
And is that mid face down or does that include the brow as well? Kind of the whole thing.
It really depends on the patient, but it can include the brow as well.
And you're doing that 20s and up?
I would say, yeah, 20s and up. And that's really, like you said, kind of 30s and some people in their 20s are really starting to see, signs of aging.
Do you think that some of that is because of people starting with these lesser invasive things earlier, like doing things like Ulthera, doing things like RF, maybe not getting it done appropriately, doing it too much? I mean, can that lead to some of this premature aging, do you think?
I think definitely for areas where people are going too deep with the RF and with the Ulthera, we definitely are seeing more skin laxity, volume loss, which can lead to early aging.
Okay, so then like a deep plane facelift, is that the kind that you do?
I do.
What age do you see people coming in for that? I know that you can't treat the age, but are you seeing, is it trending younger and younger because people are starting to move away from these less invasive things and just wanting to go? Like, I know for myself, that's me. I'm like, I just want to have the surgery. Give me a brow lift so that then I'm not doing like all the other things. I mean, Botox is an easy solution if it's just a minimal lift and kind of opening of that area that you want to get. But I did get a brow lift 7 years ago because I had very hooded eyes. And I mean, I did fat transfer in 2021 because I was
Okay.
like, I lost a lot of volume genetically. I had a kind of a narrow, long face. And so we did that. And I'm like, okay, done. Like, I want to do it and then not think about
Right.
it.
I definitely think we're seeing that more now with patients coming in at a younger age, coming in for something that's more longer lasting and truly addresses the problem. So I think when people are trying to get a lift with filler or um, other devices, they're not really treating the underlying issue, which is descent of the internal soft tissue, which is what a deep plane addresses. So it addresses the SMAS layer, which is the layer underneath the skin that loses volume and drops with time. And so, unless you're actually relifting that back into position, everything else is really camouflaging. And so, I think there's a bigger group now of patients that I think are more educated, that really understand that concept more. So, we are definitely seeing surgery and facelifting and facial rejuvenation at an earlier age. And I think it's great because I think it really addresses the problem. I think it looks more natural. It definitely lasts longer. And I think that when you do smaller procedures earlier, it helps to prevent larger procedures down the road.
Yeah, and I was gonna say it's probably kind of more undetectable. If you're going in, you're getting a facelift at 40, just to give an easy example, then you're setting the clock back a little bit. And then when you're 50, you're not gonna, it's like some people wait and they don't do anything and then they go in, I would imagine at like 70 to get a facelift, and then it's very obvious. Whereas if you're doing like these subtle tweaks over time, you're just kind of like aging very gracefully.
Yep. I think that's really the key. And I think we're seeing a lot of that earlier. And what that leads to is not only rejuvenation with a smaller procedure, but you're able to keep the incisions shorter and less noticeable and less perceptible. And there's also less of a difference between the before and after so that it's a subtle improvement as opposed to, like you said, if you're waiting till you're 60 or 70, the change is going to be much more drastic and much more noticeable.
Yeah, you wanna get that surgery where people are like, "You look really rested." Like, that's
Right,
the goal, right?
exactly.
Like, they don't know, they can't quite put their finger on it. That's you don't wanna look like you've had surgery,
Right, exactly.
basically. What are some underrated procedures that maybe people are not as aware of?
So I will say I'm pretty impressed with how social media has really driven a lot of education and awareness of different types of procedures. Um, I think one of them, an underrated procedure, would be a chin implant. It's something I would say that less than 2% of my patients who have chin implants or who have suggested chin implants for have come in asking for it. But I would say 100% of my patients that do a chin implant after we've assessed their face love it. So I think it's one of these things that we really don't see our profile. So it's really helpful when you have a plastic surgeon evaluating your face and looking at facial balance and facial symmetry to assess you from their profile. And that's something that I think makes a huge difference, even when it's a really small chin implant.
Am I a candidate?
I'd have to look at you from the side, but you look pretty great.
Because I've wanted one. My girlfriend got one, and it was like she's gorgeous to begin with. I'm like, "You're crazy. What do you don't need a chin implant." She had like a perfect kind of heart-shaped face, and she got it, and it was like game changer. I mean, it really just balanced everything, elongated, like in a really beautiful way. Um, yeah, mine is like short, I feel.
Yours
She's
looks
quite
okay to me.
really?
Yeah.
Not like a small flowers? Just
No, it looks okay to me.
okay.
One thing I think if you take a photo from the side and you kind of adjust the chin, you can really see the power of the chin. So if you make it slightly weaker, you really see how that affects the face. And I do a custom chin, and I don't mean like taking a out of the box and whittling on the table. I actually have patients get a CAT scan. I render that into a 3D image, and then I design the chin implant onto the 3D skull. It then gets printed, sterilized, and shipped to me for the patient. So I really customize it to the face. And especially for women who have a more refined lower face and delicate lower face than men, I think custom is really important because it allows you to keep that feminine shape.
Yeah, because I have a little bit of a longer chin, so I was always worried that if I did I want it for projection. We're turning this into my consult now. But I was, like, worried that from the front, then that would, like, elongate the
So there's different ways you can do
okay,
it. And so
great.
you can either just do straight projection, so in the X axis, or you can do elongation or lengthening, but you don't have to do both. So with a chin implant, you could just do straight projection
This is
without elongating
great
the
news.
chin.
Great news for me. What about jaw implants? Are people doing that? I feel like there's some celebrities recently that look like they may have done that.
So, jaw implants are something I do. I also customize that. And what that does is it changes the shape of the angle of the jaw. And you can do that by elongating, so lengthening what's called the ramus, which is the vertical length of the jaw. And then you can also change the angle. So, how sharp it is, how wide it comes out or flares. And that will really change the jawline. And I would say that's more common in men than women, but you can do it for both.
What are celebrities doing right now, if you can say? Like, what are the procedures? I mean, just from looking at people, it looks like definitely facelifts, younger, rhinoplasty, probably bluffs, like these things that really refine, but in a subtle way. But is there anything that's like trending?
I would say the trending aspect is more starting early. So I think that a lot of celebrities are starting in their 20s and 30s or 40s. And these minor surgical changes look so natural that a lot of people think it's just, aging gracefully or that it's non-surgical procedures. But I think, that's what we were talking about earlier with these key, very small subtle enhancements. We're seeing that with eyelids, faceless neck lifts. Again, chin implants is definitely something that I think a lot of people don't recognize that a lot of people have. Um, and then I think skincare. I think that's really important. So lasers and then making sure they're really both protecting the skin with sunblock and then using retinols and other sorts of um, ingredients like antioxidants to really help the skin.
Yeah, let's talk skincare because you can do all of these things, but if you're not taking care of your skin, it's only going to look so good. Your skin is definitely your canvas, right? So you want to have that beautiful canvas so that then all of this is like the cherry on top. So what mistakes do you see people making when it comes to their skin? Let's start there.
I would say the biggest one is not taking care of it when you're young and also getting too much sun exposure when you're young. And I'm guilty of that because I used to be um, a competitive tennis player and I never wore sunblock because back when I was growing up, it really wasn't something that people, thought about or took care of. But what we know is that a lot of significant sun damage when you're young really shows up later. So in your 30s and 40s and 50s. And if you only start taking care of your skin at that time, it's just not going to be enough. So, I think sunblock is really key. Making sure you apply, especially, we live in LA. There's a lot of sun exposure, a lot of pollution, and that's where antioxidants come in because they help to fight free radical damage and prevent collagen loss. And so we know that you lose about 1% of collagen in your face per year after the age of 25. So really, protecting the skin early and then doing treatments, around the age of 25 and older are helpful.
I'm with you in the sun damage club. I don't know how old you are, but I always talk about like how I grew up on the East Coast. So, we didn't have sun year round, which was a good thing, but we were in the tanning beds in the winter. And this is like the early 2000s. And we would go in, I didn't wear sunblock until I was 28 or 29. And you
Although your
can't
skin
tell.
looks
I
pretty
just got a
good.
spray tan right now, so I'm very dark because it has the bronzer in it. Like I
Yeah.
got it an hour before. So I look very tan. And yeah, I mean, ever since I turned 28, 29, I've been very diligent about sun protection. And I did like a series of IPL on my chest, my upper arms, where I had some like sun like freckles, just dark freckles. And then I did Fraxel over it. And that kind of like got me back to like a really good baseline. But I'm still waiting for that damage to come out.
Well, I actually think your skin looks pretty great. So whatever you've done, to help is working. I love a good IPL, a Fraxel, CO2, like we were talking about, which is really great for texture, fine lines, and that's something you can start. I would say in 20s and 30s. and doing it every year or every couple of years.
Doing CO2?
I think so.
Really?
Yeah, on the right candidate, of course, but yeah.
Yeah. Okay. And then what are we doing about like crepiness? Because that's the thing that I notice most because I have like thin white girl skin and I'm 39. So, like, sliding into 40 here. And I noticed that like I have thinning and some crepiness. That's kind of my issue more so than like pigment.
Right. So crepiness is often due to loss of volume and then loss of uh, collagen in the skin. So different ways to build collagen are retinols, retin-A, tretinoin, radiofrequency, microneedling, but you have to be careful not to go too deep because that can lead to volume loss and then more crepiness. And then a CO2, which is really the best for crepiness. And so I'll do that both for the face, around the eyes for my patients, but even the elbows, the hands, the knees.
Elbows. Oh, music to my ears.
Yeah.
I
So,
notice it in my elbows.
yeah.
I mean, who notices but like you do. I see in pictures and I'm like, what? Like your knees, your elbows. This is, for all the young people listening. She's 26, by the way. So you have a ways to go. But
This is what you
these
have
are
to
the
look
things
forward
that,
to.
yeah. I mean, this is like what starts happening and it's a
Mhm.
little jarring
Yeah,
sometimes.
when you're young, you think you'll never age, and when I was young, I'm looking at, my mom who's complaining about all these things, and I was like, "Oh, that'll never happen to me." And now I see everything
Yeah,
she
I
was
remember
complaining
my
about.
mom, like, when she stopped wanting to wear shorts, and I was like, "What?" Could not relate, and now I'm like, "Yeah, I don't like my knees."
Well, we can do a little CO2, a little
Oh my gosh,
microneedling, radiofrequency microneedling.
amazing. Okay, so you mentioned some ingredients. Do you think that there's a balance that we need to find with using actives? Like, I know for myself, I don't know, I have maybe 8 or 9 steps in my skincare routine. It's pretty excessive, a lot of actives, and a lot of people say, like, "That's not what you need." We really only need to do, like cleansing, vitamin C or antioxidant, moisturizer, sunscreen in the morning, and then some version of that at night.
Well, you're talking to someone that has like a 7 to 10 step routine. So,
Amazing.
you should see my skincare closet. It is full of different products. And I think what you said, like a basic cleanser and antioxidant sunblock is nice, but I am a big fan of actives. So, um, acids, growth factors, peptides, I think those are all really helpful in addition to the ones we just mentioned. So I'm a fan of a multi-step routine. Not everyone can do it. And so I think, I'm creating a product that has a lot of the actives in one so that there aren't so many steps, especially men. Men really, I think, can tolerate 2 to 3 steps max. But no, I love actives.
Yeah.
Yeah.
But men also have they're just more gifted than us. I mean,
They can wash their face with
skin-wise,
body soap and
it's
then,
crazy.
yeah.
My boyfriend is older than me, not that much, but, like, older than me, doesn't wash his face or anything, and he has the best skin, so much collagen. I mean, he gets a facial once a month, but that's it.
Wow, that's impressive.
Meanwhile, I'm, like, having to do all the things over here. But that's good to hear that you're a proponent of layering a lot of different actives and multi-step routines if that's what you want, because I always get a lot of pushback from people saying like your skin can't possibly absorb all of that. You can't layer these things. You can't mix this with that. What do you say to that?
So I think that waiting in between.
How
So
long do you need to wait?
certain growth factors, you should wait between 3 to 8 minutes before applying another product on. And the reason for that is because when you apply a different product on, it can change the pH of the skin and it could change the actives. So some actives only work at certain pHs. I think vitamin C is something that you don't need for day and night. So that's something you can just use during the day. And that does lower the pH. So you have to be careful about, letting that absorb fully before applying other skincare on top. And then I think depending on what actives and how abrasive and harsh they can be, it's okay to space them out over the week. So not doing all of them all at once on the same day.
What are some of your ride or die products? I'm so curious.
Yeah. So um, I love a good growth factor. So I love the one by Skin Medica called TNS. I love a good antioxidant. And so um, I do think that there's many types of antioxidants. I think Zeo has a great one. Skin Medica also has a great one. And then for body, I actually just use like Cetaphil, and I think that's great. It's super moisturizing, nourishing, and it doesn't have too many fragrances. And so for people with sensitive skin, that's great to use.
I want to hear about formulating your own products.
Yes.
Is
So
that just a passion for you on the side? Like, I'm so curious about the whole process.
So I, as you know, love skincare, and I think it's so important, um, both for people who are doing surgical procedures and non-surgical procedures. And I think that good skin really enhances whatever you're doing, surgically or non-surgically. So for me, I started off with my eye masks, which were initially used post-procedure. So they were used for my patients after blepharoplasties, after lasers, and after injectables. And then I started to expand the line. And so we have a bunch of new products coming down the pipeline, which we're really excited about. Each one has taken between 2 to 4 years to formulate. And so these products are, I think, going to be really incredible. A ton of actives. And I'm trying to condense it all into, less steps for people. And so we have 3 launches coming out in 2025. So we're really excited about that.
That's a long time for each formulation. Is that
Yeah.
because you're just iterating and testing and iterating?
Exactly. So
Okay.
I'm trying to throw as many actives in to one formula as possible. And, we have to change the pH of the formula and then make sure all the actives work together. And so it just takes a lot of iterations each time you change the formula.
What other trends do you think are coming down the pipeline, whether it's skincare? I know like exosomes are kind of big right now. Any procedures that you think are kind of lesser known that are coming, different trends that are coming our way?
I think we're going to see a lot more kind of patient specific, whether it's skincare or procedures. So, for instance, exosomes right now are typically derived from placental tissue. There's also plant based derived exosomes. But I think down the line, we might see, patient specific products. So, being able to draw blood or taking fat from patients, sending it to a lab, getting that process into a specific skincare or some sort of injectable for that patient. We're seeing even with breast implants, this is too early, but some companies are taking tissue from patients and creating volume for that patient so that it's not like an implant. So I think we're really going to see a lot more of that as science advances. And I'm really excited about that.
Wow. That's
Mhm.
incredible because I had to take my implants out too when I went through that whole thing that I was telling
Yeah.
you about before that I won't talk about here because everyone's heard it so often. But that's amazing that that might be something that is an option in the future for people, whether they just don't want to have an implant, a silicone implant or a saline implant, or if they have sensitivities or whatever the case may
Yep.
be.
Or if they don't have enough tissue for either fat grafting, whether or not it's to the breast or the face. So a lot of my patients are really thin, or people who have already had liposuction don't have always enough fat to do fat grafting. So I think this is going to be really key if we can build volume from patient cells.
And then what about a Botox alternative?
And then yes, and then
Can
Botox
you figure that out for me?
yes.
Something injectable that'll freeze the muscle?
I will work on that
That's
for you.
not botulinum toxin. Thank you. Well, thank you so much for coming on. It was so fun.
Oh,
Where
thank
can everybody
you.
find you and find your skincare and everything?
So I am in Beverly Hills, and they can find me on social. And my handle is Chang MD, and Naked Beauty MD is my skincare line, which is right now um, online as well as in my office. But we will be expanding that soon.
Exciting. Thank you.
Thank you for having me. This was really fun.
Thank you.